I'd like to welcome you all this afternoon to SBMI and our poster session. This is a time that we take and have an opportunity for you all to meet some of our graduates and also ask them some questions. So I'll go ahead and let the panel introduce themselves now. Anwar.
Hey everyone, my name is Suraj Anwar, class of 2006. A little bit about my background. I have a medical degree from India. Came here in 2005 to do my master's in biomedical informatics. I've been working at Memorial Hermann since my graduation. It's about 9 years now. I'm currently the director of clinical informatics over the knowledge and content within the EMR, clinical decision support, and quality, patient safety, and infection control informatics. We have a team of about 15 people who manage the day-to-day activities around all of those core topics. Majority of our work impacts the physicians as well as pharmacists, nursing staff, and the ancillary staff that take care of the patient. And our EHR is Cerner, Millennium. And we've been on Cerner since 1998, 99. So we are a little older client of Cerner, and we have a legacy database, and we have several challenges as a result of that. So I'd be happy to talk to you offline about some of those challenges.
Great. Lydia?
Hi, I'm Lydia Rubiartes, and I just graduated this fall from SBMI Master's in Research. I'm an Epic business analyst at Harris Health System. I started right after I graduated, December 15th. And I'm on the EMR reports team. It's 5 of us. And we do clarity reporting from the Epic EHR. And I mainly focus on inpatient reports.
And you just returned from Wisconsin, right?
And
from the mothership.
And I just returned from the mothership. I was there for 2 weeks for Epic training, and it's a really great learning experience. Oh, and my undergrad was in bioinformatics, so I wanted to do something health-related, but also in informatics. So SBMI seemed like the perfect choice for me.
And I'm Kimberly Smith. I'm faculty here. Some of you, I think, are my students in various and sundry classes. I returned to SBMI about a year ago as an assistant professor and faculty. I graduated from SBMI twice, once with my master's degree, and then again in 2010 with my PhD. I taught for 4 years at UT Austin in the Health Information Technology program there, and then came back to Houston.
So maybe you could start by just saying something about the school and the type of education that prepared you for your career.
You can go. Okay. I was trying to stall, obviously, because I needed to gather my thoughts. So as far as the school courses are concerned, I believe it prepared me with some of the core skills that one would need to go out into the industry. And with those core skills, I can name a few. Identifying database structures, right? Just the basics of databases, interface design, workflow analysis, user analysis. That's something we do on a day-to-day basis for every single request, every single interaction that we have with users. We're always thinking about workflows. So I think that was probably the biggest piece of the coursework that was beneficial for me personally.
I deal mainly with the SQL reporting. So for me, the courses that really benefited were her introduction class and the advanced database concepts course. even though I don't deal directly with clinicians' workflows, like he does, it actually does help with the reporting process because I'm able to think about how I need to get the data, what their process is, and inputting the data, and how I can most efficiently retrieve it.
My background's quite a bit different. I started working on my first clinical systems in 1986. I worked with a lab system at Herman before it was Memorial Herman, and I also worked on a lab system or with a lab system at MD Anderson. And I put in St. Luke's Episcopal Hospital's very first lab computer system in 1989. I left there and went to go work for a software vendor and worked for the software vendor for 10 years and did lots of different things, and then went and I helped hospitals all across the country implement systems. In 2000, I went to MD Anderson and installed a new pathology system for them, and then I went to work for GE Healthcare. So I'd worked for 5 different software vendors over several years. I heard about the Informatics program, and quite frankly, when I applied to it in 2002 or 2003, I went into it with a chip on my shoulder that I already knew everything. And when I went into 5300, and Dr. Bernstein was teaching it at the time, it was quite an eye-opener. I felt like it was a parallel universe, and I studied 30 hours a week on that one class. It was quite a shock to me of how much I did not know, and about how perhaps my life would have been easier professionally had I known some of these things through my career. So, during that time, probably interface design, the databases was very helpful. I had been working with some old technology structures and also as well as with relational databases, but it brought the science. And I started learning the why you do things and best practices and the theory and the science behind things, not just the way a particular vendor tells you how you should do something. And that's kind of what I try to bring to my students and to my teaching.
Do you have any other input you'd like to give?
Well, I'd like to ask a couple of questions to the crowd, if that's okay.
Good idea.
So, by a show of hands, how many here have a healthcare background? Okay. And then, how many of you are in the beginning of your course here at UT? Like the first year, or first 2 semesters? Okay. How many are ready to graduate? Dean? Wow, okay. So, anybody who's ready to graduate in the next 6 months? Okay, we have a handful. How many? Huh? You want the resume? Sure, I would love to. How many are going to be graduating the next year? Okay, so we have a very good mix. And when you're in the early parts of your course, it's actually hard to understand where you're going to be when you graduate. That's a given when you start this program. So it's very important for you to start understanding what people with your degrees actually go out and do in the industry. It can be somebody who is doing report writing. It can be somebody who's teaching. It can be somebody like me who's actually out in the real world helping our clinicians do their day-to-day jobs using information technology. You have to figure out what is best for you and go out and meet people such as us. Now we're here. I would encourage all of you to come out and talk to us after this program and get as much information as possible. You'd be surprised to see how helpful some of us are, okay? Because we've been in your shoes. And then once you identify what you want to do, try to look for courses that match the road that you're willing to take. And then, again, work with the people, network, memberships with AMIA, membership with HIMSS. Those are probably the 2 big things that are going to be very helpful because you meet people, you talk to them, you understand what they do. I remember when I was about to graduate, And many of you may know this person. His name is Dr. Robert Murphy. He's actually going to be full-time faculty at UT. You guys stole him from Memorial Hermann. His last day at Memorial Hermann was on Friday, so he's going to be working here. But towards the end of my course, I met him, and he came and asked me a very good question. He said, "Hey, Suraj, why don't you come and do clinical decision support for us at Memorial Hermann?" Now, at the time, I had no idea what clinical decision support was, so I asked him. He gave me a very brief explanation, and it really appealed to me. So I went out, did research, used Google, as everyone does, and I found it really intriguing that there are so many bits and pieces of data hidden in the patient's chart that a physician or a clinician taking care of the patient may be unaware of it. And that is the core principle of clinical decision support, providing in-time information to clinicians to make the right decisions. And believe it or not, to this day, I still do the exact same thing that I've been doing 9 years ago. It doesn't change. It's just that the data that you're looking for is a little bit different, and when you present it to the clinicians, maybe a little bit different. But that is something that really appeals to me, and I really took it upon myself to become an expert. And that's what we need to be in the field of biomedical informatics. We need to be subject matter experts in a core function that exists in the clinician's workflow. And you will really, really be satisfied with what you're doing.
Dr. Smith, go ahead. Or Lydia, do you have something to add about your job and how satisfied you are with it? Or
Well, while he was speaking, I actually did think on some things that I was reflecting on from my time here. And he's right. When I first started here, I had no idea what I was going to end up doing. As an undergrad, I actually did a lot of database stuff. I created an Opron database. So I had already had 3 years of experience with SQL. But when I started my classes here, it wasn't aware to me, or I was not aware of the actual opportunities that there were of jobs with SQL stuff. So when I did my practicum at Harris Health as a student report developer, I was really excited that I got to work with data and do what I had loved doing as an undergrad, but in a health field, like I had been wanting to. And a lot of the courses I took focused on data analytics because I knew that that was something I was interested in. I just didn't know what I was going to end up doing. So the fact that I get to work with data and still do SQL stuff is great for me. So when I go to work, I don't dread it. I actually like what I do.
So you've been on both sides of the street, Kim. You've been on the business side and selling the product and trying to maintain it. And now you're on the academic side. And why did you choose academe?
That's a really interesting question. Well, some of the reasons were very, very logistical, personal reasons. I wasn't going to relocate. Some of you know I own a little ranch near Austin. That's where I live. But having worked in the vendor field for several years, having worked for multiple different software vendors, that is a very high pressure environment, just as working in a hospital is a very high pressure environment. I'd done that. I'd paid my dues. I'd done I had accumulated over 700,000 air miles. I was a road warrior. I had a job where I commuted to Minneapolis from Houston every Monday morning. I got on a flight and I came home every Friday afternoon. I would not trade that experience for the world. I got to go to just about every state in the country on the company's dime. I got to see a lot of the world. I met lots of great people at lots of great hospitals. But that kind of job is for somebody that's younger and unattached and likes, has that stamina and that doesn't need to come home and take care of, animals in a house and all that kind of stuff. I wanted a little bit more stability. And I found that I really liked teaching. Teaching was always a part of my job working for a vendor. Because I always was doing training and teaching of end users and super users and helping people understand how to use the software and things like that and how best to configure. But I enjoy the classroom. I enjoy when somebody gets it, when they send me a note and going, I'm a nurse, I never understood, I never thought I'd ever need to know about SQL, and now I see how essential it is. And I'm like, yes. So 1 down, 5 million to go. So I think I found a home here in academia, but it definitely, my experience with the hospital environment and with the vendor environment definitely color how I talk to students. I try to be very pragmatic when I advise students, because I've been on all three sides of this arena. So I do spend a lot of time advising students about jobs and things like that. So
good, very good. So you can see here that we have 3 different type of graduates who are working in the field, and what they have found in the area of health informatics, and also their backgrounds and skills that they've brought. So let's open it up now to questions from y'all. Do you have some questions you'd like to address the panel? And I'll walk around with the microphone.
somebody out there's got a question.
Who has it? Here we go.
Hi, I'm actually a nurse, so I'm actually doing my nurse practitioner right now. I'm just wondering, as a nurse practitioner going into biomedical, do you think you have advantage over who doesn't have a medical degree, doesn't have a medical background?
So the question
Oh, didn't hear me?
is
As a nurse or somebody with a medical background, do you think you have a greater advantage, like somebody have
okay.
a psychology?
If you have a clinical background, is that an advantage for you, or technical skills?
Yeah,
Go ahead.
that would be me. Yeah, I can take a stab at that. I think it plays a big role, whether you have a clinical background or not. I remember my first interaction with a clinician. It was actually a physician who was really angry with our AMR implementation. And he said, "This is how I used to do it on paper. Why can't you guys just replicate what I do on paper in the computer system," right? And he's just really going at it with everybody. And so, I said, "Hey, let me go and connect with this guy." So I went and I started talking to him. The first thing he did was look at my badge. And then he said, "Who are you?" And I said, "Oh, let me introduce myself. I'm Suraj Anwar. I work on the medical informatics team. I'm actually a physician by practice." And the second I said that, his demeanor just completely changed. He made me sit down next to him, and he's like, "You should know as a physician how I feel. This is really not good. How can you make this better for me?" And I explained to him some of the challenges, and these are the exact same challenges that everyone else was trying to explain to him. But after I finished my conversation with him, he was a completely different person. I felt like a psychologist.
I want to reinforce that as well, but in this field right now, EHRs are getting all the press, but there's so much more to biomedical informatics than EHRs. In my background, coming from the laboratory information systems, labs were the first area, the first clinical area of the hospital to ever computerize. SNOMED was developed by pathologists. It was originally called Systematized Nomenclature of Pathology. So lab has a very, very long and rich history of computerization. You have diagnostic imaging or radiology, PACS, you've got perioperative systems, you've got just pharmacy systems, you've got a tremendous number of different kinds of clinical systems out there. It's not limited to EHRs. So, and nursing informatics is a large area field of study. So any sort of clinical experience and clinical training and clinical background, you don't have to be a physician. There's lots of opportunity in many different kinds of areas. Cardiology imaging is another one. Whatever kind of field you're in, if you have clinical background. What we're actually seeing, I was at an open house at Athena Healthcare a couple of weeks ago, and they said one of their biggest challenges was finding people that with a clinical background that had informatics training. They could get programmers. They could not find enough people with clinical backgrounds that had been trained in informatics. So that clinical aspect, and AMIA also in November at the National AMIA, the American Medical Informatics Association meeting, was talking about the same thing for workforce development. The number one criterion that employers are looking for is clinical, some sort of clinical credential or clinical background, then with the informatics training. So a physician, a nurse, or whatever, then with the formal training. A programmer, programmers are in demand, but programmers don't know the healthcare environment. And there's a long-standing mantra that it's easier to take a healthcare person and teach them the computer side than the reverse. So I hope that's kind of a long answer to your question, but if you, any sort of nursing background, yes, open arms, come.
Yes, another one here.
Hi, I'm also a nurse. My name's Christina, and I plan to apply to the School of Informatics. But my question is, my background is I'm a Memorial Hermann, and I work with the clinical informatics team, helping with the implementation of the system throughout the system. Now I find myself in perioperative services, and I know there's a huge, in my residency, they're saying that there's a huge need for informaticists in peri. But my question is, like, while I'm getting the training and learning the perioperative system, what are some of your recommendations as far as, like, trying to determine what are some of, like, the needs, or like how you can affect the change in perioperative when in regards to informatics?
You want to tackle that?
I can definitely tackle that. So some of the things where I think you can become an expert in is workflows and variation in the workflows, and who the key stakeholders are. What are the key pieces of information that are flowing between people in the workflows? Because if you have that down, you're essentially the brain trust for converting that into an electronic workflow. And what you'll find is that with EHRs, the out-of-the-box EHRs, they don't typically account for all the variations in the workflows. So for someone like you, I think you can just come in and say, look, this is how the EMR is going to work. It does not account for workflow steps A, D, and F. And yeah, and so I think that's where you can definitely be an asset to the team. I know from Memorial Hermann's perspective, we're actually a little bit behind on perioperative documentation. We're actually in the process of implementing it. And I think the moment is ripe for someone like you to jump in and raise your hand, volunteer, say, hey, I'd really like to help out, because we're looking for clinicians in the field who can help out. Essentially design these out-of-the-box, applications. So just keep your eyes open for that.
Who else? Another one over here.
Hi, I'm laughing at something you said earlier, that it was easier to teach a computer person, to teach a health person to learn informatics than the other way around. I think what's funny about that to me is I started off in IT before I became a nurse, and now I am a nursing informaticist. The question I have, So I work as my facility's lone nursing informaticist, and I would like to know what would be the benefit, because I am applying to the School of Biomedical Informatics, what would be the benefit of my coming to your program as opposed to maybe another?
So what would be the advantage coming to our program versus another program? And there are several programs around the country. Every program has its own personality, for lack of a better word. Our program here with Dr. Zhang as the lead is extraordinarily strong in usability and user interface design, human cognition, things like that. But we also are very strong in other areas as well. We're also moving, many of our courses are online and are able to be taken by people. Most of our students work full-time. Our average student that comes into the program now is 35 years old and works full-time. So trying to do a program almost anywhere that requires physical attendance is almost impossible for most people. We are the program in the state of Texas. UT Austin has a program as well, but that is tailored for people that are not employed because it requires that students go Monday through Friday, 5 days a week, all day long for 9 weeks. So that doesn't fit the average working adult person. SBMI has a long track record. We've been here since the late 90s. Is that right, Bob?
Yep.
And of course, our greatest strength is our affiliation with the world's largest medical center. Nobody else can touch that. There is nothing else in the world like what we have across the street. And we also have the strength of the University of Texas system. So.
Any other questions from over here? Anyone on this side? Anyone else? Okay, then I guess we can kind of summarize, and the panel will be available after we end, so please feel free to approach and ask any questions that you have. And so now let's just give them a little round of applause and thank them for doing this for us.